This is Dr. John Brimhall, a special guest, Dr. Linda Huxtable from Florida, a renowned naturopath, and Kevin Jellerson, who is the one that got me interested in Bemer. So I just want to take a few minutes for those of you who may not know much about Bemer. I have probably $300,000 worth of equipment here in my house. I have a research center, and I treat only complicated patients here. I have everything from the big PEMFs and 5 or 6 different kinds of lasers. I have an oxygen tank. I have about everything you can imagine for treating patients. And I've said it before and I'll say it again, if I had to give up everything, I'd want to hang on to at least one laser. But everything else I would probably give up, even my hyperbaric chamber, for the Bemer. And the interesting thing about the Bemer, people say, well, what do you use it for? And I say, it doesn't matter what the condition is. What could you imagine would improve if you could improve the oxygen content to every cell in the body? Even the microcirculation, which is up to 74% of the circulation of the body. I mean, we never even talked like this before because we had no way of doing it, much less prove we've done it. But here with the Bemer, it's a special sine wave that actually, on its way up with that S curve, it's laying on its side, it peaks 40 times before it hits the top. And they have found that that particular wave increases the circulation through the body, even the microcirculation. It also helps those blood vessels to move blood through there fantastically. So let's say that myself, I'm 69 years old. I like to exercise every day. I ride up and down in the hills here in Denver, Colorado. And I was really having a tough time getting in shape last year. The winter hangs on so long here, so you're several months not being able to ride unless you're on a snowmobile. And then I was having to literally push my bike up the last hill coming to my house. I have 5 major hills between here and the big circle that I take. And I do the HIIT training, high intensity training. So that means when I'm riding up the hill, once I warm up, I go as hard as I can to where I can't go anymore, and then you push yourself a little bit more. This increases the hypothalamus and the pituitary output. This increases growth hormone. This gives you the best level of fitness that you can possibly have. Well, by the time I've done the first 3 hills, and then I go up the 4th one, and coming back the 5th one, I was literally having to get off and walk my bike up the hill. But once I started on the Bemer, literally within a couple of days, I not only didn't have to walk my bike up the last hill, I was shifting gears going up the last hill, and I did that this morning. I actually was in 2nd gear climbing up. So I just don't know why I wouldn't use the Bemer. That's the bigger case for me. Every morning when I get up, and I usually get up about 5 in the morning, I go downstairs to my research center, I turn on the Bemer. And I use the Bemer, and I'm now at a progress where I don't only do the 8 minutes on the pad, the whole Bemer pad where you lay down on it, but I'm also doing 20 minutes on a special exercise where I can work on my brain. My wife thinks that might be a good idea. So I can increase the circulation in my head, I can increase the circulation in my ears and in my eyes, and it's just a phenomenal procedure. So what I'm going to do, without further ado, I'm going to turn this over to Dr. Huxtable because she has some slides that's going to kind of take you through the operational and some of the things that she does in her practice. So Dr. Huxtable.
Hi, it's great to be with everybody tonight. And Dr. John was the one who told me that Bemer was in the country. And I had tried to buy a Bemer a few years before when my dad came down with pretty bad peripheral artery disease. I was having trouble walking, and I got on the internet and started doing some research on microcirculation and found the Bemer and couldn't buy one. The infrastructure of the Bemer company was not set up very well in the U.S., couldn't find anyone who owned one, couldn't reach anybody in Germany. And so I knew what Bemer did, and I knew how it was different than PEMF, but I just finally gave up. So as soon as he told me that he had gotten one, I was very excited and went ahead and bought a couple and have been using them in my practice for, about 6 months now, I guess. And I've seen some really extraordinary things. And like Dr. John, I had before I moved to Florida full-time, I had a 14,000 square foot clinic in Atlanta, and I had an office in Vail, and I also owned every piece of equipment known to man. And so I've had a vast array of equipment that I could try out, and some things I wouldn't be without, and some things I kind of let go. I still see patients every day. My practice, I see, it's a concierge practice, so I have patients all over the country. But I have gotten a lot of patients on Bemer. And one thing that you realize pretty quickly is nothing else does what Bemer can do. I think one of the most asked questions I get from doctors is, how is this device going to duplicate this other device that I have, or interfere with it, or compete with it? And what you find is that nothing does what Bemer does, because you may be able to increase the circulation temporarily, but when you turn off whatever device you're using, guess what's going to happen? Your microcirculation is going to go back to where it was before you use that device. Bemer is the only device that we have that has been tested by Dr. Rainier Klopp, who wrote the book on microcirculation, and he has improved the Bemer. He has taken it through a few generations to the point where it now, an 8-minute treatment will last 10 to 12 hours. And like Dr. John, I have a very, very busy day. My Bemer 8-minute treatment is done when I get up in the morning before I get out of bed, because I sleep on the Bemer, and then I go through my day. And if I'm not in a tournament competing and my legs aren't tired, then I go the whole day and do Bemer again before I go to bed, and then I put it on the sleep program. And the sleep program is designed to detoxify your organs, regenerate and detoxify the organs. The aim of a therapeutic program using the Bemer is to stimulate the body's own regulatory mechanisms so that the dysfunction can be brought under control by the organism itself, using the natural mechanisms of the body that were designed for healing. So as we like to say, Bemer is not disease specific, and there are no contraindications except if you have an organ transplant and you are on a drug to suppress the immune system so that you don't reject that organ. So that is, and I get calls all the time, is, can you use Bemer if you have this? Can you use Bemer if you have that? The answer is always yes, and you start at very low intensities and you listen to the body. You don't want to put an older person on Bemer who has very occluded circulation and start, trying to push that blood through and detoxify them, because they're not going to be happy with you and they're going to get scared. So there's a very conservative protocol that we use, even for athletes, that starts at intensity 1, and each week you add 1 intensity till you get to intensity 6. Then you cycle back through 3 a week, 4 a week, 5 a week, and 6 a week, and you use the attachments or the modalities in order to spot test different areas that you need work on. Either shoulders, oh my goodness, I've had many great things happen with everything that is imaginable, from eyesight to shoulder injuries to polycythemia to all my cancer patients are on Bemer, because no matter what you give somebody, if you spend as many hours of their life looking at people's blood under a live blood microscope, dark field microscopy, and you saw the fibrinogen and the platelet aggregation and the milieu that is full of every kind of pathogenic bacteria, because it has evolved, or it has mutated to live in the swamp because the circulation is occluded, you understand that people are basically hypoxic. They are not getting that blood flow through capillaries that are 1/3 the size of a hair. And guess what? Nothing you give them. You put them on these expensive protocols, and you look at their blood under the device that Dr. Klopp invented, and you see that they're getting 1 blood cell through those capillaries occasionally. How in the heck is anything supposed to get where it's going? So it makes your protocol so much more effective. It makes anything else you use so much more effective, because you're not dealing with a swamp. One of the most frequent questions that I get is, I got it today, and they said, I was on Dr. Pollack's website. Why didn't he do a review on Bemer? And it's very simple. in this slide that you see on your screen, comparison of various PEMF devices is a bit misleading because Bemer is not technically a PEMF. What Bemer does is it uses the PEMF frequency as a carrier to bring this Bemer sine wave, which is a patented sine wave, into the body. And as Dr. discovered, it was the only thing that caused the vasomotion of the capillaries to deliver blood to the capillary bed, and on the other side to detox it from carbon dioxide and waste. So if you look at if you Google Bemer, IMRS comes up. And IMRS is using very duplicitous advertising because they're using old Bemer stats and they're using the new Bemer picture among other things, and they've gotten themselves into trouble. But if we go to the next slide, so Bemer uses PEMF to deliver the patented sine wave on that carrier frequency. It's like if you think of a radio station, it's going to be there. It needs content to deliver information. So you have to have whatever DJ or whatever news program on that radio frequency in order to benefit from that frequency being there. This shows the venular oxygen utilization. Bemer, of course, is the one in the orange. And you can see immediately within 2 minutes after you start, your circulation goes from looking like nothing is getting through the capillaries with this great device that Dr. Klopp invented to be able to look at it live time, to looking like a Ferrari racetrack. And unfortunately, I don't have that slide tonight. I thought it was going to be presented, but it's a short video, and we can give you the link to get to that short video to actually see this. So you could see the other devices never got to where Bemer was as far as oxygen utilization. This was done in the intestines, which were the target tissue of where they were measuring. And after 4 days, which is the last measurement, you can see that Bemer still far exceeded. The red line is where they turned the Bemer off, and you can see Bemer far exceeded what the other devices were able to do. And that is not saying anything negatively about PEMF devices. I own a big one, a Delta Pulse, a Magna Pulse. I love my PEMF. I don't ever want to be without it. I know Dr. John has one also, but it doesn't do the same thing. It doesn't do anywhere near the same thing. It is as different as a fork and a spoon. You know, people ask me, well, which is better, Bemer or PEMF? I say, do you like a fork or a spoon better? You know, it depends what you're trying to do. If we're talking about delivering, opening the microcirculation, we want to use Bemer. So I do thermography on all my patients, and we can only see a partial part of this thermography that the patient was so kind to let us use. And the sides of this patient, she was on a 1 to 10. She was in an 8 to 10 every day, had been for a long time. And what was very distressing was the pattern in the before picture on the left breast. Having done thermography for 20 years now, I can tell you that you do not see this kind of change in 3 months. You can see how the inflammation in the axillary space really decreased. And that spot on her breast that we sent her in for an ultrasound because it was very concerning, decreased. And not only that, but after 3 months, she told me on the phone that, and it took her 3 times of telling me that she wasn't in pain anymore, that she was completely out of chronic pain. And this had been a chronic pain sufferer for a long time. You could see the gut, and already we're seeing some of the blue in the center of the gut around the umbilicus there, but we're seeing the red decrease, and we're seeing, and that's what she did. She took one of the modalities, the B body is the mat you lay on, and that treats the entire body, and you are able to enhance the Bemer signal by using one of the devices and using it over specific areas. This woman is just thrilled with Bemer and uses it every day. Another problem that I know all of you out there hear about all the time is sleep deprivation. And we have, millions and millions and millions of people that 16 million, I think, people, 40 million suffer from chronic sleep disorder. I wrote that down because I don't remember numbers very well. So 40 million people suffer from chronic sleep disorder, and I know you think that they're all in your practice. The typical adult only gets about 25% sound sleep. This is a 71-year-old man who has a long history of sleep disorder, everything from sleep apnea. He was only getting maybe an hour of sound sleep at night, waking up 2 to 3 times a night, not sleeping soundly. And this was chronic, and he would sleep 4 to 5 hours. In January, he started using the Bemer, and we measured with using a Jawbone fitness band, and he was getting 30% sound sleep and waking up 2 to 3 times a night. By April, just amazingly, his sleep went to 50% sound sleep, and he woke up 0 to 1 time a night. By May, he was getting 55% sound sleep, and he was going right to sleep, and he now sleeps about 9 hours, 8 to 9 hours every night. This is extraordinary, because you all know about the recent research on any kind of sleep sedatives and how it increases death from all known sources of mortality. They are just very dangerous. So people who sleep better have more energy. They have a better feeling of well-being. They're rested. So if you were just going to use this for sleep, I see extraordinary changes in people. And then after you use and this was before he had even begun using using it to sleep on. I sleep on my device every night, and as patients progress and they go through week 6, you begin having them sleep on the B-body 1 time in the next week. And most of them don't like it. Most of them are not happy with you. They don't want to do it again. They don't sleep. They're restless. They don't have a good night. And it's because they detox. The urine is very strong in the morning. It's very dark. It really detoxes them. So you tell them, well, the reason we only have you sleep on it 1 night the first time you do it is so you forget how miserable you were next week. We talk you into it again. So usually by the next week, if I do some things to help open the detox pathways, just simple things like Epsom salt detox baths, or whatever you do in your practice to help their detox pathways. The next week, and we make sure that the B body is under the mattress pad so it doesn't feel hard against them, and they can't even feel it then. The B body, the mattress pad, the sheet or a grounding sheet, and then the person sleeps on it, and they don't feel it. And by the second night that they sleep on it, it's usually quite a bit better. The third week, if they can do it 3 nights, then you're not going to get it away from them. They're going to want to sleep on this every single night. Here's some of the, there's that 40 million people. That's where I got that. Have a chronic sleep disorder. 62% of American adults have a sleep problem a few nights a week. So many people, and so many young people. A lot of it is from the computers, the screens, everything. But everything from cognitive impairment to irritability to increased risk of diabetes. You know what the problems are of not sleeping. And your HGH isn't working very well. You're not producing HGH. So when I talk about Bemer, after looking at blood under the microscope for so many years and wondering what we could do to heal varicosities, to heal the circulatory system. So many problems with the circulatory system. And in the thermography that I do the grayscale. And it used to be that when I saw the varicosities in the legs and all over the body, you try Aeschylus or horse chestnut or whatever, and I really didn't get that great of a success with it. It wasn't something that I even wanted to look for because I didn't know what to do when I found it. I just didn't have great success. And of course, women will go in for sclerosing or saline injections in the legs, which you know isn't a good idea. And after I got Bemer and saw what it was doing to my patients with thermography, I got pretty darn excited. And I have seen varicosities in the legs reduce significantly in a very, very, very short time, in a week after beginning to use Bemer. So if you think about a swamp and you think about the organisms that mutate to adapt to living in that swamp, we look at a swamp and we may not think it looks very pretty, but though the mothers of those organisms think that they are beautiful because they are very well adapted to living in that swamp. Okay, so looking at blood under the microscope, it really and truly, as you watch the organisms mutate into very virulent forms of pathogens, you really think of a swamp. It's a quagmire. There's fibrinogen, things aren't moving. Used to be when I looked at a child's blood, the blood was, cells were round and the cells were moving with this incredible energy across the screen. Now all the kids are sick too, but you saw what the blood should look like. And now pretty much everybody's blood looks like a swamp. And you know how those pathogens are going to mutate and change because they are just trying to survive. And then you think of a beautiful mountain spring that's racing, full of oxygen, structured water, which should be in our system as well, and how it's not going to look like that swamp. The organisms are going to be very different, and in our bloodstream, they're symbiotic to our health. They're organisms that we need and that are symbiotic to our health. And this is the best visual, other than that little video that we don't have right now, that will show you what is going to happen to your patient after you do that 8 minutes of Bemer. So
Linda,
that is all I have for tonight.
Linda,
And well, go ahead.
Can you hear me, Linda?
Yeah, I can hear you.
Before you switch channels, tell us any personal experience you and your husband had while we're switching over to the next speaker. How did you